Thanks so much for listening to the Wild Health Podcast. If you're a Wild Health patient, you might not know, but you have access to our referral program. This gets your friends and family 25% off Wild Health services. Just head to Clarity, and in the top right corner, you'll see Refer a Friend. Click there, and you'll be brought to a page with your referral code. Happy sharing.
Welcome to the Wild Health Podcast. It's Dr. Julie Foucher and Dr. Erin Donaldson back to talk more on women, and specifically this time on women and fasting. We've been getting a lot of questions about this.
What's up, Julie? Good to be back chatting about women's health again. We got to get the guys on here to talk about these subjects sometime.
That's true. That would be fun sometime. We should do the two of us and Stone and Carl and just, I don't know, argue it out, fasting for men and women or something like that.
I love it.
Well,
nice.
Yeah. Why don't we just start by, some definitions of what we're talking about with fasting? Because I think that there's so many ways to do this. And as we'll get into, this is where the personalization comes in. But I see it come up with a lot of patients. There's, the basics, like we talk about with all of our patients, making sure you have a window every night where you're not eating, which I think 12 hours is a good rule of thumb. But I don't know that we need to call it fasting, but in today's world, oftentimes we do. And then there's, intermittent fasting or time restricted feeding, which is having a longer window each day where we're not consuming food, whether we're restricting calories or not, just consuming all our calories in that window. And then there's also, fasting, doing longer periodic fasts for certain reasons.
For sure. And I think the time restricted and intermittent fasting can get kind of confusing for people. From my understanding, intermittent fasting is just, it's any type of like variation of when you're varying the time that you're eating and the time that you're fasting. And it can include some caloric restriction too. Like you can do the 5 and 2 where you're only doing, on 2 days of the week, you're eating like about 500 calories or so, or you can do like a daily intermittent fast where you're doing, 14 hours of fasting or 16 hours of fasting, or even 18 to 20 for some people, and eating in a very short window. But from my understanding, both of those are technically intermittent fasting. Is that your understanding of it?
I think so too. And I think you made the important point between, is this, intermittent fasting where we're restricting calories periodically, like, as part of that, or is it just restricting the time in which we are consuming the same amount of calories in that time restricted feeding window?
Yeah, I would say for most of the women I talk to anyway, when they are fasting, they are also calorically restricting. Most of them, whether or not it's in the strict definition, I mean, most of them are not strictly tracking their calories, but they're getting full, for the same size meals, and they're having 2 or 1 meal a day versus the 3 meals a day that they would otherwise be having. So they're just anecdotally what I see with my patients, I would say most of them are also calorically restricting. I don't know if that's what you see.
I see that as well. And especially as we talk about things like protein, I know we talk about that with a lot of our patients, and especially, in certain situations, it's really important to be mindful of protein intake. And with that shorter fasting window, I find women having a much harder time meeting their protein goals.
Yeah. So what are your thoughts on women and fasting versus men and fasting, Julie? And have you done it? Have you felt like benefits yourself from it? Like, what are you kind of seeing with this?
Great question. So I think, as always at Wild Health, the answer is very much, it depends. It's a personalized approach. And so, hopefully we can dig into a lot of those different factors that we consider. But I think that I am much less keen on fasting for women than I am in men. I think there are definitely situations where it can be helpful. But I find more often than not, just as an observation and women coming to us that are already doing fasting, more problems that are resulting from that than actual like improvements in their health. So that's where I think being like understanding the impact that the fasting is having on your physiology, and then being intentional about how you do it, when you're doing it, if you are doing it, and monitoring becomes really important. And then personally, yes, I have done it. I have done a variety of different types of fasting, and I find the fasting that's most helpful for me is periodic. It's so not what we've been talking about so far, the time restricted feeding or the intermittent kind of on a weekly basis, but it's, a couple times a year doing a longer fast. So I've done the Prolon a couple of times, which is a fasting mimicking diet that was popularized by Dr. Walter Longo. And I've also done just a full-on fast several times, which for anywhere from 24 hours. I've once done a 5-day fast, which was not for health reasons. It was more for mental clarity and sort of spiritual reasons. And I coupled that with a silent solo retreat. So very cool experience.
You went for it.
Happy to, go down that route, but I don't necessarily think there was a lot of additional health benefit for going out 5 days. I think I could have gotten the same health benefit from a shorter, maybe 3-day fast. But I personally I think that the more I learn, the more I'm trying to be very intentional about how I use it and when I use it. And I find week to week, I used to skip breakfast a lot, but now I'm listening a lot more just to my hunger signals and, definitely shooting for 12 hours each day of not eating, but not being so strict on that to make sure that I am fueling properly and supporting all the other, stressors that I have going on.
Yeah, I would say largely I completely agree with everything you said. I also see, working a lot with the autoimmune population at Wild Health, those patients, myself included, tend to be a little more sensitive to stressors and, triggers to the nervous system, triggers to our adrenals, and our hormones. And so fasting is one of those. And we can go into that in a little bit more detail in a minute. But, women in general, I see, are more sensitive to fasting than men, just like you shared. And I anecdotally regularly see implications on sex hormones, on cortisol levels, on blood sugar levels and insulin levels, not in the way that we want to see the change happen from fasting. Not that there can't be benefit. I would say if I had to categorize the women that I see benefit more, it's women that are significantly insulin resistant to begin with. Sometimes I do see some benefit from fasting and some improvement in their insulin resistance, especially if they're peri or postmenopausal. If they're already, sex hormones are already diminishing, I see their bodies physiologically function a little bit more like a biologic male. It's not obviously that they are, but just that there's less implication on those sex hormones and that more we see the benefits metabolically from fasting. But I'm very careful, especially in my active women between the ages of like 18 and 40. I mean, I would say almost across the board, I have them in a 10 to 12 hour feeding window. And the more active they are, the closer I am to 12 on that. So I just see, otherwise I'm seeing protein cut, I'm seeing caloric density cut, and I'm seeing implications down the line, especially if these women are coming to us wanting to have children in the future or wanting, their periods to be optimized. I think there's not a lot of room for improvement in those areas when we add fasting in. These are already typically really high achieving women that have stressors going on in other areas of their lives. They usually have really high functioning jobs and they're working out regularly and, all these other things that could be, it could be construed as stressors, even if they're good things. Right. And then you add fasting to the mix and it usually just kind of sets a cascade off. Personally, I've also done fasting. I used to be a big fan of it because the data, and we can get into the data here in a second, the data on men and fasting is robust and it's super, super strong and super positive. The data on women and fasting is essentially non-existent, not completely non-existent. We'll talk about that, but it's very minimal. But it was initially when all this was popularized, thought that this was such a positive thing. And of course, like other health trends, before we share it with our patients, we want to try these things, right? And my body responded really, really poorly. Initially from fasting, I did feel a boost in energy. And I still do if I like accidentally fast because I'm traveling or something else. Like ketones give you a boost in energy when you're fasting. But I did this around the time of the pandemic. And when I had more time to exercise, I would be like running in the middle of the day or doing HIIT work in the middle of the day. And when I mixed those two stressors together, even though I felt great on a day-to-day, I just stopped having my period for like 3 months. So my sex hormones just were not happy with that at all and essentially just shut down reproductive function for a few months because they were like, just not supported with enough calories, I guess. So just really interesting. And I see maybe not that extreme of a response in a lot of my patients, but I see a lot of their hormone numbers change, not for the better.
Mm-hmm. Yeah, I totally agree. I think it makes sense too to also step back and think about why, so even when women are coming to us and they are fasting, what is the reason, right? And a lot of it is coming from, like you said, the data on men, and there's really great data on the impact of fasting for metabolic health, like you said, things like cancer prevention, just longevity. Obviously, fasting's been a practice. It's been around for a very long time. People were doing it not necessarily for health reasons, but culturally for spiritual reasons. So it's something that like humans have been doing for a long time. And there does seem to be some benefits. But I think what you were sharing about that there isn't a lot of data specifically on women, and the fact that women are really sensitive to this because we have these monthly hormonal cycles, which vary a lot. And so being intentional about how we're doing it and what are the overall stressors that we have on our system and how fasting fits in. Sometimes we could be shooting ourselves in the foot, because if we're trying to fast for improve body composition, but then actually it turns out the fasting is adding more of a stressor to our system and increasing our cortisol, and now we're having some HPA axis dysfunction, and it's going to become harder to lose body fat. So like, first starting with the question of why. Is it just for mental clarity? Is it for body composition, metabolic health, and then honing in on is that something that's actually beneficial, or what's the right way to do it so that we can get that intended result?
Yeah, I love it. And then also I think about when you say why for fasting, I think like evolutionarily too, it kind of makes
Yeah.
sense. I was doing some reading on, biologically the theories as to why men do better than women, like biologic males do better than biologic females with fasting, is because, when we didn't have like Uber Eats and microwaves and refrigerators, right? People had to like hunt and gather. And when there was famines, people had one of two responses to fasting. Like women would stay home, feed the children, breastfeed, like, the most evolutionarily adaptive thing would be to put on body fat to sustain them through a famine, right? To sustain their children and like evolution essentially. But for men, this metabolic boost they get, I mean, the data is pretty clear in men. I mean, there's up to like a 200% increase in testosterone utilization, up to like a 200% increase in growth hormone. They get improved insulin resistance. I mean, the metabolic benefits, not even talking about autophagy and what happens with longer fasting and cancer prevention, like you mentioned, but even just like the immediate metabolic benefits of fasting are pretty clear in men. And that makes sense because largely they were the ones going out and hunting, and, not to talk about gender roles and like dive into that whole subject,
Sure.
but just evolutionarily, the theories kind of check out as to why there would be a difference there, because women feed children with their bodies, and it wouldn't make sense to like have them, it would make sense for them to put on fat in response to a famine. So that made a lot of sense to me.
And you think about what happens to your hormones, right? If there's a famine and you don't even have enough food to feed yourself, obviously it's not a great time to procreate. So evolutionarily, like your whole system is shutting down, like you experienced when you were running and fasting during the pandemic. It's like not a good time right now. And so that's something, I mean, as women, I think it is amazing that we have that signal that can, okay, something's going on with my period. Obviously there's something off, what's going on. But thinking about this also, as you mentioned, from like a total stress load perspective, I think is also really interesting. Because let's say we have a woman who's like, I really do want to do fasting because maybe I want to get the benefit. And maybe we should talk through some of those scenarios. Like, number one, you've got a patient, you work with a lot of autoimmune patients. So let's say that, they want some of the benefits as far as autoimmune disease for fasting. How would you approach it in that scenario?
Probably the same as I would approach it for like a detoxing, or say they have a strong family history of cancer or strong genetic predisposition to cancer. I would do, cyclical fasting, like what you mentioned before, periodic fasting. So, and I would start low and go slow, just like with every other hormetic stressor that I recommend to my patients with any sort of HPA axis dysfunction or autoimmunity, or, anything along that spectrum. So I would recommend starting with like, 16 to 24-hour fast and have it probably be timed with their cycle, not in their like luteal phase or right at the beginning of their period, but probably like between like 1 week and 14 days of their menstrual cycle, if they can track it, where they're more like apt to responding positively to hormesis during those times. And if y'all don't know what hormesis is, just basically a stressor that you can put in on your body. We have a bell curve response to stressors, and the poison's in the dose. So a little bit doesn't impact us. The right amount has a positive impact, like the whole what doesn't kill you makes you stronger thing. And then too much of it is detrimental, and we don't respond in an adaptive way. So I would start small. And then as they respond well to that, if they have an adaptive capacity for hormesis, which not all my patients that come in the door with autoimmune do, but they can develop that as they build a foundation of health up, up to like a 2 or 3 day fast every quarter or a couple times a year, like you said, is really ideal. That's what I try to practice. And that's really ideal ultimately to get into some cellular cleanup and, theoretic cancer risk reduction. Again, women haven't been like totally borne out in those studies, but it makes a lot of sense. Detox pathways are optimized, and it can be anti-inflammatory theoretically as well. Although if you take hormesis too far, that's probably not anti-inflammatory. So it's just a little bit of a tight wire. But that's how I approach it. And that's how I approach it for most women, honestly, unless they're in that like really insulin resistant and or postmenopausal phase.
Totally. Yeah. I think about that, like you said, for cancer prevention, just women who are interested in general, like longevity. And it's something that I think a lot of us tend to have this mindset of like, well, if it's a good thing, more is better. So why don't I do a 24-hour fast once a week? Or why don't I do this like every day? But like you said, it is a hormetic stressor. And so too much of a good thing becomes a bad thing. It's like going to the gym when you haven't worked out in a few months and overdoing it, and then you can't move the next day. It's not necessarily the adaptation that you're looking for.
Yeah, for sure. I mean, theoretically, fasting is great because we know it suppresses mTOR, which is something we talk about a lot in terms of longevity. I know it's something our listeners know a lot about. A lot of them do. It also reduces blood sugar, in most people in studies, but again, most of those studies have been done on men, right? So I would be really curious what a really nice controlled study does on this for women. I think I found one controlled trial for women. It's the one I sent you yesterday, and it is, I don't know if you looked at the end of that study, but there was 23 people in the study. It's very
and it was
small.
8 weeks. Yeah, it was a short
and
study.
It was 8 weeks. The results were still profound for y'all so y'all can know what we're talking about. It was the study on sex hormone response in women to intermittent fasting. So they were doing either a 4 to 6 hour feeding window, which is pretty aggressive, I would say. I mean, that an 18 to 20 hour fasting window is an aggressive start, and 8 weeks is short amount of time, but maybe not for that aggressive of a fasting window. But they compared premenopausal and postmenopausal. They took out the 40 somethings. They took out the perimenopausal women, but they compared pre and postmenopausal fasting and non-fasting, and saw about a 14% drop in DHEA, which I know y'all have heard me talk about that on the HPA axis dysfunction podcast recently. But we look at DHEA a lot because it's one of the hormone precursors produced by the adrenals that helps produce all our hormones. And it's super important for tons of things, for that really anything that's involved with sex hormones, both androgens and estrogens, as well as significantly involved with reproductive capacity in women. So you can take a woman that's like in her childbearing years, and in 8 weeks, she can significantly lower her reproductive capacity by fasting, essentially. So it's extrapolated, obviously, but I think it makes sense.
Totally. Yeah, it is so powerful with just overall how sensitive we are as women with these changes in our hormones. And I think, maybe just talking about, say you have a woman who is interested in fasting, and, what are some of the ways where we can monitor, or we can use the data that we have to assess whether it's appropriate or like whether it's too much. And I think the example you just said, like if you have a woman who's coming in who's already having some symptoms of HPA axis dysfunction, or, on her labs, we're seeing low DHEA or elevated sex hormone binding globulin, which is another one which can be elevated when there's excessive fasting or caloric restriction, then right there, those are signs that like additional fasting is probably not going to be helpful. And we actually want to focus on rebalancing that hormonal axis, which includes, adequate nutrition and maybe pulling back on any other stressors. Also just thinking about other stressors. So one, like, are you getting enough nutrition? So like we talked about at the beginning, if you are fasting, we still need to make sure you're getting enough nutrition in that feeding window or whenever you are consuming food. I think I see a lot of women who are under eating or like chronically under eating, and that can cause issues. The exercise, like you said, if you have a woman who's very active, who's doing a lot of training, a lot of exercise, again, probably not the best scenario to be introducing a lot of fasting. And then other stressors like psychological stressors, again, are going to affect that stress axis, or just environmental triggers, illness, other signs of inflammation, things like that. So if the whole like overall stress load is high, fasting is just adding fuel to that fire. And I think it is in some of those situations, like you mentioned, maybe appropriate to do periodically to help kind of rebalance the system or go through that like autophagy process. But probably not on a routine, like intermittent or time restricted feeding basis.
Yeah, for sure. I would say it's very few and far between when that I recommend a prolonged fast within the first 6 months of working with one of my autoimmune patients, which is obviously a little bit of a more extreme example because they almost across the board have HPA axis dysfunction and, stressed nervous systems because of the chronic illness. Which came first, the chicken or the egg? I don't know, but it depends on the person. But I would say it's very, very rare that fasting helps more than it hurts until we get some of that foundation healed. But not all women are in that situation. That being said, the intense exercise and the high achieving career woman and the busy mom and the, any number of other scenarios, it doesn't have to be emotional stress or a stressed nervous system to move the needle with the HPA axis, like you were just talking about. I mean, I think a lot of times we normalize chronic stress and we even not even normalize, but we like applaud chronic stress and high achievement and intense exercise and some of these things. And it's really great to an extent, right? But the numbers don't lie. And I would agree with you. When someone's coming in, if their DHEA is like 60, then I'm like, not a good idea.
Yeah.
We got to get your body a little happier first. And I would agree. A lot of these women are also under eating. I mean, I even find that in myself. Like you probably know this about me. I hate tracking macros. I hate tracking calories. Not how I live my life. And occasionally I do it just to keep an eye on things, because sometimes I track for a day and I'm like, oh man, I'm eating like 500 calories less than I thought I was, or I'm eating like 40 grams less of protein a day than I thought I was. And I have a pretty good idea compared to the average person, I would say, about what that looks like on a plate. But it's easy to do, especially like the more active you get, the more busy you are, the easier it is to forget a meal. And then if you add adrenal dysfunction in there, a lot of those women just aren't even getting hunger cues. So they're like, I'm not eating breakfast because I'm not hungry for breakfast. I'm like, we got to figure out a way to turn that hunger cue back on and get those hormones back online that cause hunger, because this is just going to propagate the cycle.
I find myself in the same boat. I'm someone who for so many years was training at a lot of hours a day and was eating a lot of protein. And now if I'm like, unless I'm really mindful about it, I'm dramatically under eating protein. So there are many days where I just don't get enough because I'm not paying attention, because I also don't like tracking. So it's hard, like even for the two of us who talk about this all day long, like it requires a lot of attention. So especially, if women are in the scenario where they are experiencing any symptoms or health problems or, I see a lot of women with, like sleep issues with sleep, like waking up in the middle of the night, that is related to under eating. And so there are so many ways that our body reacts to this, and like you said, a lot of times we're losing those hunger cues. So it's a little counterintuitive.
Yeah. So if you are a woman listening to this podcast, obviously it's difficult to give like blanket things that work for everybody. Like Julie said at the beginning of the episode, it really, really depends on so many things, which is why we practice precision medicine. But I would say in large part, if someone has HPA dysfunction on their labs, if their cortisol is really low or really high, if they have a really suboptimal DHEA, if their heart rate variability is in the toilet, those types of things are signals. Or if you're having chronic symptoms of inflammation and autoimmunity of any type, like those things are signals that the HPA axis is really not super happy. Even if your period's really irregular and messed up, that's another sign most of the time that there's some HPA axis dysfunction. Thyroid is another example. When your TSH is too high and you have hypothyroidism, I don't think I've ever had a single patient with hypothyroidism benefit from fasting. Like it makes it worse almost across the board. So those would be times I would be like really, really reticent and talk with your doctor. If it's something you want to do, I would talk with your doctor and really look at labs and really ask yourself why, like Julie was saying, like, why are you wanting to do this? Like what's the motivation behind that? What's the real goal here? And is there a better way of getting at that? And I would ask your provider about that. I don't know if you agree with that, or if, and then maybe we talk about the times when it makes a little more sense to fast and how to do that safely.
Yeah, I totally agree with those. And I think, in those situations, in most, like you said, most cases, a 12-hour window, like consuming your food in about 12 hours, fasting or not eating within about 12 hours is a great sort of approach for most people, considering. And then if you're in that boat, also considering talking to your doctor before you even consider like a periodic fast, like we've been talking about a couple times a year. And then I think just also we have to mention the areas where fasting is an absolute no-go, like non-negotiable, which is eating disorder history. Well, I never want to say absolute, so let me take that word back. And I don't think anything is ever absolute. There's always situations that I'm sure I'm not thinking about, but anyone with an eating disorder history, that is a population I would be extremely cautious and would highly recommend not fasting. Also, obviously, pregnancy and breastfeeding would be times where we're not considering fasting at all.
Yeah, for sure. And then just younger people, of course, are never going to be a good candidate for that. Someone below, I would even say probably younger than 18, or younger than 21 even. And then people that do a little better, I would still ask your doc if you're a woman and you're considering this, if you're type 2 diabetic, if you have significant insulin resistance, those are gray areas for me. And it really depends. Like take hemoglobin A1C as an example, which for those of you who don't know, it's a 3-month picture average of your blood sugar. And some of my patients come in with an average blood sugar of, an A1C of 6.0, and they have screaming insulin resistance, and it's clearly coming from insulin resistance and trending towards type 2 diabetes. And probably that patient would benefit from a little bit of fasting. And sometimes patients have an A1C of 6.0 and they have low insulin levels, and they have high cortisol levels, and it's completely coming from HPA axis dysfunction and stress. And those patients would significantly worsen their outcome, in my experience, by fasting. So it's just really so dependent. So I would, in those areas, really, really think about asking your doc and just really looking into the reason why these things are happening, because the answer is going to be really dependent on that.
Yeah, I think that's such a great point, because that is something that I see somewhat frequently. So if there is a patient where it's appropriate to incorporate more fasting, like maybe someone with metabolic dysfunction that's truly, coming from, blood sugar, insulin issues, then how would you approach that with the patient and monitor to make sure that it's having the intended effect?
Yeah, I would probably check their HPA axis markers, a couple months in. I would repeat their A1C and insulin, probably check all of that 3 months in, to be honest, is what I would do in real practice. I would probably have them on a glucose monitor to make sure they're not like waking up with really high blood sugar, or it's not just coming from their workouts or some other stressor. And I would probably start with about a 10-hour fast or 10-hour feeding window for those people. I wouldn't do like some men with diabetes, I'll jump into like a 16 or 18-hour fast, depending on how they're doing and how experienced they are in this. I don't think I've ever done that with a female patient, to jump into that extreme of a fast right away. And I don't think I've ever seen significant benefit from doing it that extreme. Obviously, my patient population is a little biased, so you might have different experiences.
No, I totally agree. I think it's just the point of, just like we do with everything at Wild Health, it's doing something with a specific intention and then having a way that we can monitor to see if that's actually moving us in the right direction and not having any unintended consequences. And I think the other important point, which we talked about a little bit earlier, was in women, when you are doing this fasting, considering timing this with your menstrual cycle. So where this becomes important is in the second half of our cycle, in the luteal phase, where we have progesterone that's higher. That is where we are, just in general, as we talk about this exercise, if anything, we are more susceptible to stressors. So like those stressors become like something that normally would not be a big deal becomes a big deal. It's like, think about it when you have a day when you're just emotionally sensitive. It's like, that's how your body is. And so stressors that increase our cortisol then impact our progesterone levels. And we can become very susceptible to, having negative or unintended consequences of fasting. Same thing like we talked about with exercise, like overtraining or doing a lot of intense exercise during that time is maybe less helpful. So if we are doing fasting, maybe trying to time that more in the early phase of the cycle and then not doing it during that luteal phase so that you're getting most of the benefits.
And for those of y'all who don't know, luteal phase is the second half, like she said, of the menstrual cycle. And for women or men that don't know about what that means, I mean, that's essentially your body's acting like it's pregnant every single month for half the month. It's preparing its body for pregnancy if it did occur in ovulation that month. So temperature goes up, heart rate goes up, insulin goes up, all those things change. Like Julie's saying, the body's just more sensitive because it's basically putting, the life of another being in front of itself, essentially. So it's super interesting what happens. And then women do a lot better with stressors earlier in the month, especially that second week. Women feel higher energy and better adaptation to stressors. So that's a super good point, especially if you're going to do those longer fasts. It's a good time to incorporate those. And then one other thing to mention before we wrap up, I think, is just a note about the timing. A lot of people in real life, when I see them fast, they're skipping breakfast because it's socially much easier. But what's problematic about that is that, then they tend to really just dump a lot of calories in their body late night, and binge later in the evening after the sun's down, when they're done working, et cetera, et cetera. And that's an easier time to eat with family usually, or with friends. It's socially easier. So you're really backloading a lot of your calories and a lot of your protein, which is just not the ideal time to signal mTOR and to support the body with protein. And it's not really also not ideal to calorically dump right before you go to bed. It decreases sleep quality. It increases insulin resistance. So you're kind of swimming upstream. You're looking to get a bunch of benefits from fasting, like decreasing insulin resistance and all these other things. But if you destroy your sleep quality in the meantime, or you destroy your body's ability to build muscle because you're not signaling mTOR the right way, it's really problematic. So, ideally, if you're going to practice intermittent fasting, you're really cutting off calories earlier in the evening, and you're still getting a good protein bolus in the morning is how I would recommend people doing that. That just, sometimes is too much of a social sacrifice, which is, of course, also not good.
That's right. Or even thinking about, it doesn't have to be every day, right? Like maybe you do that during some weekdays when it's not as big of a deal, so that if you're going to dinner with people on Friday or Saturday night, it's not one of your fasting days. But I'm really glad you brought that up. I think that, thinking about just circadian rhythm and a lot of approaches to fasting include trying to eat when it's light out. And I think there's a lot of evolutionary truth to that as well. And maintaining that fasting window, or that not consuming food in that time before bed being really important.
Yeah. A common thing I recommend for women is eat in a 10 to 12-ish hour window and try not to eat within 3 hours or so before you go to sleep. Yep. And that usually keeps hormones happy, and it usually allows women's hunger signals to get back online where they can
Mhm.
really start listening to their bodies again and have some intuitive eating and some intuitive signals, and usually levels out the menstrual cycle and all kinds of stuff. So that's usually my rough blanket advice, which is terrible to give. And obviously this is not medical advice.
This is not medical advice, but general things that used to work well. I totally agree with that. So for the general population of women who are in reproductive age, who are candidates, or not who are candidates, just reproductive age, who are generally healthy, do not have any like contraindications, 10 to 12-hour window during the day, avoiding eating that 3-hour window before bed, considering doing a periodic fast a couple times a year, ideally during that follicular phase of your cycle, that early phase of your cycle. It sounds simple. We don't need to overdo it, but very powerful, very potent.
Yeah,
And then for
just
women who have,
wrap it up.
yeah, that's it, right? And then for
all we
women
need.
who have, who have metabolic disease or even cancer is another like topic that it's a hot topic we haven't talked about, but who have an indication for doing more fasting, then working very closely with your doctor to understand where your numbers are, what your total, stress load is, what your HPA axis looks like, and then doing it in a very intentional, monitored way. And of course, the populations we talked about would want to avoid fasting, like eating disorders and pregnancy and breastfeeding.
Yeah, and if there's anybody out there listening to this that runs medical studies, if you want to run a study on women and fasting, that would be so rad.
Yes, please sign me up. Awesome. Well, this was great, Erin. Thanks again for chatting.
Always fun.
Thanks so much for listening to the Wild Health Podcast. If you want more daily health education, be sure to follow us on Instagram, which is filled with health optimization how-tos, grocery shopping lists, guided breathwork posts, myth debunking, and so much more. You can find us at Wild Health MD on Instagram.